It's my feel-good breakfast show.
Introducing new PANADO Pediatric Syrup 5ml sachets. They're really convenient to pack and easy to use, so you're always prepared for pain and fever anytime, anywhere.
Welcome back, everybody. It is your feel-good breakfast show here on S3. It's time to still focus on the little ones this morning, and we know that having advice from professionals gives, parents the extra insight needed when tackling colds and flu as the winter season approaches. It is certainly here. Now, today we are discussing how to spot the signs of a cold as well as flu and how to treat it with our very good friend, pediatrician Professor Claudia Gray. She's here this morning. How are you doing?
Good. Well, thanks. How are you?
I'm very good. Well, I'm okay,
Yeah.
only because it is winter season. So as a parent, it comes with a lot of stress, and we know that this is the time where our little ones get sick. What should we be looking out for when it comes to colds, flus around this time?
So you're absolutely right. This is heaven for viruses at the moment. Autumn and winter provides the perfect setting for certain viruses, especially respiratory viruses that attack your respiratory system. Now, when we talk about colds and flus, I think we sort of really need to understand what the upper respiratory tract is and what the lower respiratory tract is. So the upper respiratory tract is your nose and your ears and your throat and your trachea, and the lower is then your lungs, your bronchi, and your actual lung tissue. When we talk about a cold, we're normally talking about an upper respiratory infection, as a start at least, which mainly affects the nasal tissues. So the child can present with a sniffly nose, a runny nose, a blocked nose, which is a big problem for most little kids. And with that, they might have a scratchy throat. They might just present with grumpiness or irritability, more tantrums than usual. Systemically, with a cold, they're normally not that unwell. In other words, they're still playful, bit grumpy, but no high fevers, etc., maybe a low-grade fever. But when we talk about a flu, this is normally, it can be the same virus, but with a different set of effects. So flu or flu-like illnesses cause more systemic effects. So you get chills, you get aches, you get muscle aches, bone aches, often high fevers, loss of appetite, poor sleep. So that's a slightly different end of the spectrum. But remember that both colds and flus can cause complications such as chest infections, ear infections, sinuses. So it's important to recognize when is it just the virus and when is it a complicated infection.
Professor, would you then say that a paracetamol is recommended to assist babies with colds and flus during the season?
Well, the first thing to say is that there's no cure for viruses, really, for most viruses. So you're not going to give a tablet and cure a common cold. And we all know that, for example, with COVID now. But certainly there are two principles. The one is that you have to keep the child comfortable. And the second is that you have to try and prevent complications or recognize them early. And keeping a child comfortable certainly means giving them things to reduce their pain and fever, like paracetamol, fairly early on in the illness. So while it's not going to cure the virus, it plays a very important part in just reducing the symptoms, keeping the child so that the kid can eat and sleep, which all help you to fight the virus more effectively.
That being said, I did say that we are seeking professional help, and that is why you're here. When it comes to the do's and don'ts, when it comes to administering these paracetamol with the other multivitamins that's given to our kids on a daily, what are some of those?
I think my main do's and don'ts, or my main do's are, number one, get in quite early, and then secondly, regularly, especially in the first few days of illness, and lastly, at the correct dose, so it's safely. There's no point in waiting till a fever is 39 and the kid's lying on the floor and shivering. There's, our body is dealing with the virus, not the fever. Okay, so if a kid is uncomfortable, then treat them. And at the right dose. For example, paracetamol is approximately weight divided by 2. So if your kid weighs 10 kilos, then it's 5 mils of paracetamol syrup. And the first 2 or 3 days of a virus, the child is normally particularly uncomfortable or has a particularly high swinging fever. Then give it regularly. So you can give something every 4, 5, or 6 hours so the kid always feels a little bit better. You can also combine it. There's no problem with combining basic meds like paracetamol with an anti-inflammatory or a multivitamin, etc. and then give it at a safe dose, which we've described. But one little pointer, and if you have kids, you'll know that this is the case. Often when kids are sickly, they don't really feel like taking too many oral medications. So remember not to bombard them with this syrup and this cough syrup and this multivitamin and that. They'll start having an aversion and then start spitting out what's actually really important for them. So stick to what's important, your temperature control, your pain control, maybe your nasal spray, and lots of hugs and tender loving care.
That is definitely on the list. Is this the same for babies when it comes to do's and don'ts administering paracetamol to the babies?
So it depends on the age of the baby. Generally, a baby over 6 months of age, yeah, exactly the same. The younger babies, we're often a bit more cautious with, so rather have them seen earlier on in the illness. And they can have paracetamol from an early age, but it depends on their weight. So you have to be very careful with the dosing according to weight.
Professor, as always, it's so great for you to come in, give us all your professional advice. Hopefully, this has helped you, all the moms out there. Winter season is approaching, the colds and the flu system is there, but getting professional advice is always a winner.
Being a parent can be challenging, but stepping out is when things get real complicated. That's why new PANADO Pediatric Syrup 5ml sachets are here to make the job easier. They're really convenient to pack and easy to use, so you're always prepared for pain and fever, anytime, anywhere. PANADO, a dose of care.